MMT, foot eversion with plantar flexion, peroneus longus and peroneus brevis. Assist the patient to the short sitting position with the ankle in neutral position. The trunk may be supported by placing the hands flat or fisted at the sides or by leaning the trunk slightly. Sitting on a low stool slightly in front and to the inside of the test foot. Passively move the patient's ankle through plantar flexion and foot through eversion. You are not assessing the infeel. You are determining how much range the patient is able to move in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to plantar flex the ankle and evert the foot as you observe for any substitutions. Stabilize the patient proximal to the malleoli. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include using the toe flexors to assist with the motion. You must instruct the patient to keep the toes relaxed. The patient may also attempt internal rotation of the hip to assist against resistance. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient proximal to the malleoli. The other hand is contoured around the dorsum and lateral border of the forefoot. This hand will apply the resistance in a direction toward inversion and slight dorsiflexion. You may bring your hand slightly more underneath if you're having trouble applying the resistance with this hand position. Apply the force for a 5-second count. Grade 5, normal. The foot everted with ankle plantar flexion to the available range of motion, and the patient was able to hold the end position against maximal resistance with no break in the position. Grade 4, good. Foot everted with ankle plantar flexion to the available range of motion, and the patient was able to hold against strong to moderate resistance. Grade 3, fair. The patient is able to move through all the available range of motion in foot eversion with ankle plantar flexion, but is unable to tolerate any resistance. There's no position change for grade 2, 1, or 0. Grade 2, poor. The patient completes partial range of motion only. For grade 1, palpate the muscle and tendon of the peroneus longus and brevis. To palpate, place your fingers on the lateral leg over the upper 1/3 just below the head of the fibula. The tendons of the muscle can be felt as it comes behind the lateral malleolus proximal to the base of the 5th metatarsal. Grade 1, trace. Palpable contractile activity at the muscle or tendon of the muscle with no joint movement. Grade 0, no palpable contraction.